To 2020, overdose deaths from opioids basically doubled in Nebraska. And with fentanyl more prevalent, those numbers are only growing.
Medications for addiction treatment can give those struggling with opioids a second chance at life. Here's the problem. KETV Investigates discovered access to the three main medications to help people get off opioids is limited in Nebraska. Quinicia Frazier uncovered more doctors could be prescribing some of these meds. They just aren't applying for a special waiver.
For people struggling with substance use disorder, Norfolk, Nebraska is considered to be a recovery town.
There's a lot of recovery facilities and long-term care or long-term treatment facilities as well.
At the Midtown Health Center, doctors prescribe two medications to treat opioid use disorder: naltrexone, commonly called Vivitrol, and buprenorphine, better known by the brand name Suboxone.
It is a process, so you have to go through, a drug and alcohol eval and make sure that you're a candidate for the program first.
Dr. Allison Wallach says Suboxone has really helped a lot of her patients get on the path to recovery. But the most recent data DHHS could provide shows there were 45 doctors across the state prescribing Suboxone, the majority in Omaha and Lincoln.
The likelihood of abstinence only, of just saying, I'm never going to use an opiate again, the likelihood of that working is on its own is very low without medication.
Miles away from Norfolk in North Platte, Nebraska, Janet Bernard recently retired as a physician. Since 2008, Bernard says she prescribed Suboxone to her patients.
There's no question there is an access issue.
Although she worked in North Platte, she says she had patients coming to her from other parts of the state, like Kearney, Grand Island, and even Omaha.
I've had a lot of people that I say, okay, you live in Omaha, you need to find a provider in Omaha. It's closer to you. They can't get in. We're not taking new people. We're not doing this. We're not doing that.
KETV Investigates learned that since April 2021, providers who are treating 30 patients or less no longer need special training to prescribe Suboxone for opioid use disorder. They just need to request a special waiver. Yet many Nebraska doctors, physician's assistants, and other qualified licensed healthcare providers aren't requesting it.
I do think we need more in Nebraska, especially in more of the rural areas.
And you've got people that really want to get sober, but they don't have the help that they need.
Shanda Kohler says another medication, methadone, is the reason she's been sober from opioids for a year.
These medications are going to save so many lives because of the fact that they're going to alleviate a lot of the misery that goes along with getting off opioids.
But access to methadone can also be a problem. UNMC addiction medicine doctor Kenneth Zuha says that medication can only be provided by methadone clinics, and there are only 3 in the state, found in Omaha and Lincoln.
Some of them have patients, though, that drive an hour or two one way to get their methadone on a daily basis.
But Bernard says it's rare that a patient is able to take methadone but not Suboxone.
I think every person who directly cares for patients, knowingly or not, sees people who have trouble with opioid use disorder, and they should really become Suboxone providers.
Bernard emphasizes that using MAT, or medications for addiction treatment for opioid use disorder, is not substituting one drug for the other. She and Zuha say there needs to be better education.
How to assess for, how to screen for, how to talk to, and how to treat folks that have substance use disorders.
Dr. Zuha and the Nebraska DHHS say there is an initiative to provide support, training, and mentoring for doctors when it comes to substance use disorder. It's called Project ECHO, and it stands for Extension for Community Healthcare Outcomes. Project ECHO is a remote program. DHHS says that can especially be helpful for practitioners in rural areas who treat opioid use disorder. Back to you.